Question 1. A nurse is caring for a toddler with severe dehydration secondary to gastroenteritis who is receiving IV fluids. Which reassessment finding indicates the child is developing a life-threatening complication requiring immediate action? A. Moist mucous membranes. B. Capillary refill of 5 seconds. C. Urine output of 1 milliliter per kg per hour. D. Weight gain of 0.2 kilograms. Answer: B. Capillary refill of 5 seconds. Rationale: worsening capillary refill reflects compromised tissue perfusion and possible progression to hypovolemic shock. The other findings indicate improving hydration status. Question 2. A nurse is reviewing a care plan to reduce the risk of sudden infant death syndrome (SIDS). Which interventions require correction by the nurse? A. Placing the infant supine for sleep. B. Using a firm crib mattress. C. Allowing supervised prone play while awake. D. Using a loose blanket for warmth. Answer: D. Using a loose blanket for warmth. Rationale: loose bedding increases the risk of suffocation. Supine positioning, firm mattresses, and supervised tummy time are evidence-based SIDS prevention strategies. Question 3. A child with a history of asthma arrives at the emergency department with audible wheezing, nasal flaring, and an oxygen saturation of 89%. Which action by the nurse reflects the most appropriate clinical judgment? A. Obtain a detailed asthma history. B. Administer prescribed short-acting bronchodilator. C. Prepare the child for chest radiography. D. Notify respiratory therapy after assessment. Answer: B. Administer prescribed short-acting bronchodilator. Rationale: immediate intervention to correct hypoxia and airway obstruction is the priority. Additional assessment and diagnostics must not delay treatment. Question 4. Yes or no? Should a nurse administer a pediatric medication when the dose is within the recommended range, but the child's current weight has not been verified during this admission? A. Yes. B. No. Answer: B. No. Rationale: pediatric medication safety requires current weight verification. Administering medication without confirming weight increases the risk of dosing errors. Question 5. A nurse assesses an infant with projectile vomiting, poor weight gain, and visible peristaltic waves. Which clinical judgment is most appropriate? A. Initiate oral rehydration therapy. B. Prepare the infant for surgical evaluation. C. Administer antiemetic medication. D. Encourage smaller, frequent feedings. Answer: B. Prepare the infant for surgical evaluation. Rationale: these findings strongly suggest pyloric stenosis, which requires surgical intervention. Other options delay definitive treatment. Question 6. True or false? Pediatric patients are at increased risk for adverse drug events due to developmental differences in metabolism and organ maturity. A. True. B. False. Answer: A. True. Rationale: immature liver and kidney function alters drug metabolism and excretion, increasing the risk of toxicity in children. Question 7. 4 pediatric clients are assigned to a nurse. Which child should the nurse assess first? A. A child with acute stridor and drooling. B. A child with a fever of 39 degrees Celsius, 102.2 degrees Fahrenheit. C. A child with controlled postoperative pain. D. A child with mild dehydration. Answer: A. A child with acute stridor and drooling. Rationale: signs of airway obstruction represent an immediate threat to life and require rapid intervention. Question 8. Which nursing actions demonstrate adherence to pediatric medication safety standards? A. Using 2 patient identifiers. B. Calculating doses based on outdated weight. C. Independent double check of high-alert medications. D. Measuring liquid medications with household spoons. Answer: A. Using 2 patient identifiers. And C. Independent double check of high-alert medications. Rationale: these actions reduce medication errors. Outdated weights and household spoons increase dosing inaccuracies. Question 9. A hospitalized preschooler exhibits separation anxiety and refuses treatment. Which nursing intervention best supports therapeutic care? A. Limit parental visitation to reduce dependency. B. Perform procedures quickly without explanation. C. Encourage parental presence during care. D. Delay care until the child is calm. Answer. C. Encourage parental presence during care. Rationale. Family-centered care reduces anxiety and improves cooperation. Limiting visitation increases distress. Question 10. Yes or no? Is a nurse ethically obligated to question a provider's order if it conflicts with pediatric safety guidelines? A. Yes. B. No. Answer. A. Yes. Rationale. Nurses have a professional and ethical duty to advocate for safe, evidence-based care and prevent harm. Question 11. A child with suspected bacterial meningitis is admitted to the unit. Which nursing action should occur first? A. Initiate droplet precautions. B. Administer prescribed antipyretics. C. Obtain blood cultures. D. Assess neurological status. Answer. A. Initiate droplet precautions. Rationale. Infection control is the immediate priority to prevent transmission. Other interventions follow isolation. Question 12. True or false? Infants are at increased risk for hypothermia due to limited ability to regulate body temperature. A. True. B. False. Answer. A. True. Rationale. Immature thermoregulation and higher body surface area increase heat loss risk in infants. Question 13. A nonverbal toddler is postoperative and crying inconsolably. Which assessment tool provides the most accurate pain evaluation? A. Flack scale. B. Numeric pain scale. C. Visual analog scale. D. Verbal descriptor scale. Answer. A. Flack scale. Rationale. The Flack scale is designed for nonverbal children and evaluates behavioral indicators of pain. Question 14. Which assessment findings indicate worsening respiratory distress in an infant? A. Nasal flaring. B. Grunting respirations. C. Intercostal retractions. D. Slow capillary refill. Answer. A. Nasal flaring. And B. Grunting respirations. And C. Intercostal retractions. Rationale. These are classic early signs of increased work of breathing. Slow capillary refill reflects perfusion, not respiratory effort. Question 15. A nurse evaluates parental understanding of fever management in children. Which statement requires follow-up teaching? A. I will monitor fluid intake. B. I can alternate acetaminophen and ibuprofen as prescribed. C. I will give aspirin for high fever. D. I will observe my child's behavior. Answer. C. I will give aspirin for high fever. Rationale. Aspirin is contraindicated in children due to the risk of Rice syndrome. Question 16. Yes or no? Is informed parental consent required before administering sedation for a non-emergency pediatric procedure? A. Yes. B. No. Answer. A. Yes. Rationale. Informed consent is legally required for non-emergency procedures involving minors. Question 17. A nurse suspects child abuse based on assessment findings. Which action demonstrates correct clinical judgment? A. Confront the caregiver immediately. B. Delay reporting until proof is confirmed. C. Document findings objectively and report concerns. D. Discuss suspicions with coworkers. Answer. C. Document findings objectively and report concerns. Rationale. Nurses are mandated reporters and must document objectively without confrontation or delay. Question 18. True or false? Evidence-based pediatric nursing practice combines research evidence, clinical expertise, and family preferences. A. True. B. False. Answer. A. True. Rationale. Evidence-based practice integrates scientific evidence with clinical judgment and patient and family-centered care. Question 19. Which outcome best demonstrates effective discharge teaching for parents of a child newly diagnosed with diabetes mellitus? A. Parents verbalize fear of hypoglycemia. B. Parents correctly demonstrate insulin administration. C. Parents request additional pamphlets. D. Parents state the child will adjust over time. Answer: B. Parents correctly demonstrate insulin administration. Rationale: return demonstration confirms skill mastery and readiness for safe home care. Question 20. Which nursing strategies enhance effective communication with pediatric patients and families? A. Using developmentally appropriate language. B. Excluding the child from discussions. C. Incorporating play during teaching. D. Collaborating with caregivers. Answer: A. Using developmentally appropriate language. And C. Incorporating play during teaching. And D. Collaborating with caregivers. Rationale: these strategies improve understanding, trust, and cooperation. Excluding the child increases anxiety and reduces engagement. Question 21. A 6-month-old infant receiving IV fluids for dehydration develops tachypnea, periorbital edema, and bounding pulses. Which nursing action reflects the most accurate clinical judgment? A. Increase IV fluid rate to improve perfusion. B. Stop IV fluids and notify the provider immediately. C. Elevate the head of the bed and reassess later. D. Administer antipyretics for possible infection. Answer: B. Stop IV fluids and notify the provider immediately. Rationale: these findings indicate acute fluid overload progressing toward heart failure. Continuing fluids would worsen pulmonary edema. Immediate cessation and provider notification are required. Question 22. A child with septic shock is admitted to the pediatric ICU. Which nursing actions demonstrate priority clinical judgment during the first hour of care? A. Administer broad-spectrum antibiotics after cultures. B. Delay fluids until blood pressure decreases further. C. Initiate rapid isotonic fluid boluses. D. Apply continuous cardiac and oxygen monitoring. Answer: A. Administer broad-spectrum antibiotics after cultures. And C. Initiate rapid isotonic fluid boluses. And D. Apply continuous cardiac and oxygen monitoring. Rationale: early aggressive fluids, monitoring, and timely antibiotics are evidence-based interventions for septic shock. Delaying fluids worsens tissue hypoperfusion. Question 23. A toddler with suspected epiglottitis is sitting upright, drooling, and refusing to lie down. Which nursing decision best prevents rapid deterioration? A. Obtain a throat swab for culture. B. Keep the child calm and avoid invasive assessment. C. Encourage oral intake to prevent dehydration. D. Place the child supine for examination. Answer: B. Keep the child calm and avoid invasive assessment. Rationale: agitation or invasive procedures can precipitate complete airway obstruction. Maintaining a calm environment preserves airway patency. Question 24. Yes or no? Should a nurse allow a parent to administer a home medication at the bedside without verifying the order and dose? A. Yes. B. No. Answer: B. No. Rationale: all medications administered in the hospital must be verified for safety and legality. Allowing unverified administration risks serious medication errors. Question 25. A child with a ventriculoperitoneal shunt presents with lethargy, irritability, and a high-pitched cry. Which interpretation demonstrates the highest level of clinical judgment? A. Expected postoperative adjustment. B. Possible shunt infection or obstruction. C. Normal developmental behavior. D. Side effect of analgesics. Answer: B. Possible shunt infection or obstruction. Rationale: these are classic signs of increased intracranial pressure. Early recognition prevents permanent neurologic damage. Question 26. True or false? Children with cyanotic congenital heart disease may have falsely elevated oxygen saturation readings. A. True. B. False. Answer: A. True. Rationale: poor peripheral perfusion and abnormal hemoglobin can produce misleading pulse oximetry values. Question 27. A nurse must decide which pediatric client requires immediate reassessment. Which scenario represents the greatest risk for sudden decompensation? A. A child with sickle cell disease reporting pain of 8 out of 10. B. A child with asthma whose wheezing has suddenly stopped. C. A child with pneumonia receiving oxygen at 2 liters per minute. D. A child with postoperative vomiting. Answer: B. A child with asthma whose wheezing has suddenly stopped. Rationale: sudden absence of wheezing may indicate severe airway obstruction and impending respiratory failure. Question 28. Which assessment findings most strongly suggest chronic child neglect rather than accidental injury? A. Multiple injuries at different healing stages. B. Consistent caregiver explanation. C. Poor growth trajectory. D. Delayed presentation for medical care. Answer: A. Multiple injuries at different healing stages. And C. Poor growth trajectory. And D. Delayed presentation for medical care. Rationale: these findings reflect ongoing neglect. Consistent explanations reduce suspicion of maltreatment. Question 29. A neutropenic child receiving chemotherapy develops a temperature of 38.1 degrees Celsius, 100.6 degrees Fahrenheit. What is the nurse's most critical action? A. Administer acetaminophen. B. Notify the healthcare provider immediately. C. Encourage oral fluids. D. Recheck the temperature in 1 hour. Answer: B. Notify the healthcare provider immediately. Rationale: fever in a neutropenic child is a medical emergency requiring rapid intervention to prevent sepsis. Question 30. Yes or no? Is a nurse legally accountable for administering a pediatric medication exactly as ordered if the dose is unsafe? A. Yes. B. No. Answer: B. No. Rationale: nurses are accountable for safe practice and must question unsafe orders rather than blindly follow them. Question 31. A nurse evaluates discharge readiness for a child with newly diagnosed epilepsy. Which finding indicates the greatest risk for readmission? A. Parents express anxiety about seizures. B. Parents demonstrate medication administration correctly. C. Parents misunderstand seizure first aid steps. D. Parents request neurology follow-up. Answer: C. Parents misunderstand seizure first aid steps. Rationale: inadequate emergency response knowledge places the child at immediate safety risk. Question 32. True or false? Pediatric patients often experience abrupt cardiovascular collapse with minimal warning signs. A. True. B. False. Answer: A. True. Rationale: children compensate well until sudden decompensation, requiring vigilant monitoring for subtle changes. Question 33. A child in diabetic ketoacidosis suddenly develops headache, bradycardia, and decreased responsiveness. Which complication should the nurse suspect first? A. Hypoglycemia. B. Cerebral edema. C. Metabolic acidosis. D. Fluid deficit. Answer: B. Cerebral edema. Rationale: these signs indicate increased intracranial pressure, a life-threatening complication of DKA treatment. Question 34. Which nursing behaviors demonstrate expert-level family-centered pediatric care? A. Negotiating care plans with caregivers. B. Limiting parental presence during procedures. C. Incorporating cultural health beliefs. D. Providing consistent interdisciplinary messaging. Answer: A. Negotiating care plans with caregivers. And C. Incorporating cultural health beliefs. And D. Providing consistent interdisciplinary messaging. Rationale: these actions strengthen trust, adherence, and outcomes. Excluding parents increases anxiety and resistance. Question 35. A child being observed for appendicitis reports sudden pain relief followed by increasing abdominal rigidity. What is the nurse's priority response? A. Offer oral fluids. B. Notify the provider immediately. C. Continue observation. D. Administer analgesics. Answer: B. Notify the provider immediately. Rationale: this pattern suggests appendiceal rupture with peritonitis, requiring urgent surgical intervention. Question 36. Yes or no? Should a nurse respect a school-age child's refusal of a non-emergency procedure even when parents consent? A. Yes. B. No. Answer: A. Yes. Rationale: ethical pediatric care includes respecting assent and addressing the child's concerns whenever possible. Question 37. A nurse suspects opioid toxicity in a postoperative child. Which assessment finding requires immediate action? A. Pain score of 2 out of 10. B. Respiratory rate of 8 breaths per minute. C. Mild nausea. D. Drowsiness after medication. Answer: B. Respiratory rate of 8 breaths per minute. Rationale: respiratory depression is a life-threatening adverse effect of opioids and requires immediate intervention. Question 38. True or false? Children may underreport pain due to fear, developmental level, or desire to please caregivers. A. True. B. False. Answer: A. True. Rationale: behavioral and developmental factors often lead to underreporting, contributing to undertreatment. Question 39. A nurse assesses a parent performing epinephrine autoinjector use. Which action indicates unsafe technique? A. Holding the injector in place for 3 seconds. B. Injecting into the lateral thigh. C. Massaging the injection site afterward. D. Activating emergency services after use. Answer: C. Massaging the injection site afterward. Rationale: massaging can accelerate absorption and increase adverse effects. Question 40. Which indicators best demonstrate failure of interdisciplinary collaboration in pediatric care? A. Conflicting discharge instructions. B. Inconsistent pain management plans. C. Shared documentation. D. Unclear role responsibilities. Answer: A. Conflicting discharge instructions. And B. Inconsistent pain management plans. And D. Unclear role responsibilities. Rationale: poor coordination increases error risk and undermines patient safety. Question 41. A 4-year-old with pneumonia has been receiving IV antibiotics for 48 hours. The child suddenly becomes restless, tachycardic, and has a drop in oxygen saturation from 95% to 88%. Which nursing action reflects the highest priority clinical judgment? A. Increase oxygen flow and reassess in 10 minutes. B. Notify the provider and prepare for possible escalation of care. C. Encourage coughing and deep breathing. D. Administer PRN antipyretics. Answer: B. Notify the provider and prepare for possible escalation of care. Rationale: acute deterioration despite treatment suggests worsening disease or complications such as sepsis or pleural effusion, requiring rapid escalation. Question 42. A nurse is caring for a child in compensated shock. Which findings support this assessment? A. Tachycardia. B. Normal blood pressure. C. Delayed capillary refill. D. Hypotension. Answer: A. Tachycardia. And B. Normal blood pressure. And C. Delayed capillary refill. Rationale: children maintain blood pressure until late stages. Hypotension indicates decompensated shock. Question 43. A nurse receives report on a child with a tracheostomy who is increasingly restless with audible secretions. What should the nurse do first? A. Suction the tracheostomy. B. Increase oxygen delivery. C. Notify respiratory therapy. D. Obtain vital signs. Answer: suction, the tracheostomy. Rationale: airway patency is the immediate priority. Restlessness and secretions suggest obstruction. Question 44. Yes or no? Should a nurse delegate nasogastric tube feeding to a newly hired UAP who has not demonstrated competency? A. Yes. B. No. Answer: B. No. Rationale: delegation requires verified competency. NG tube feeding carries aspiration risk. Question 45. A child with nephrotic syndrome develops sudden abdominal pain and guarding. Which complication should the nurse suspect first? A. Constipation. B. Peritonitis. C. Urinary tract infection. D. Medication side effect. Answer: B. Peritonitis. Rationale: children with nephrotic syndrome are at high risk for spontaneous bacterial peritonitis, a medical emergency. Question 46. True or false? In pediatric patients, respiratory failure often occurs before cardiac failure. A. True. B. False. Answer: A. True. Rationale: hypoxia and respiratory compromise commonly precede cardiac collapse in children. Question 47. A nurse must choose which pediatric client to reassess immediately. Which situation requires the most urgent attention? A. A child with burns reporting increased pain. B. A child with asthma using accessory muscles despite treatment. C. A child with gastroenteritis refusing oral intake. D. A child with postoperative fever of 38 degrees Celsius, 100.4 degrees Fahrenheit. Answer: B. A child with asthma using accessory muscles despite treatment. Rationale: increased work of breathing after intervention signals impending respiratory failure. Question 48. A nurse suspects failure to thrive in an infant. Which findings support this concern? A. Weight below the 5th percentile. B. Delayed developmental milestones. C. Age-appropriate head circumference. D. Poor caregiver-infant interaction. Answer: A. Weight below the 5th percentile. And B. Delayed developmental milestones. And D. Poor caregiver-infant interaction. Rationale: failure to thrive involves poor growth, delayed development, and psychosocial factors. Question 49. A child with hemophilia falls and hits their head. What is the nurse's priority action? A. Apply ice and observe. B. Assess pain level. C. Notify the provider immediately. D. Document the incident. Answer: C. Notify the provider immediately. Rationale: head trauma in hemophilia carries a high risk of intracranial hemorrhage and requires urgent evaluation. Question 50. Yes or no? Is it appropriate for a nurse to override a provider order if it places a pediatric patient at immediate risk? A. Yes. B. No. Answer: A. Yes. Rationale: patient safety supersedes hierarchy. Nurses must act to prevent harm. Question 51. A child with cystic fibrosis has thick secretions and declining oxygen levels. Which intervention demonstrates expert prioritization? A. Administer bronchodilators only. B. Initiate chest physiotherapy and airway clearance. C. Encourage rest. D. Limit fluid intake. Answer: B. Initiate chest physiotherapy and airway clearance. Rationale: mobilizing secretions improves ventilation and oxygenation in cystic fibrosis. Question 52. True or false? Pediatric patients are more vulnerable to rapid electrolyte shifts during IV fluid therapy than adults. A. True. B. False. Answer: A. True. Rationale: immature renal function and smaller fluid reserves increased risk for imbalance. Question 53. A nurse notes that a child with sepsis has warm extremities, bounding pulses, and flushed skin. Which type of shock should the nurse anticipate? A. Hypovolemic shock. B. Cardiogenic shock. C. Distributive septic shock. D. Obstructive shock. Answer: C. Distributive septic shock. Rationale: Warm shock with vasodilation is characteristic of early septic shock. Question 54. Which nursing actions reduce the risk of central line-associated bloodstream infection (CLABSI) in pediatric patients? A. Strict hand hygiene. B. Daily review of line necessity. C. Routine line replacement every 24 hours. D. Sterile technique during access. Answer: A. Strict hand hygiene. And B. Daily review of line necessity. And D. Sterile technique during access. Rationale: evidence-based bundles reduce CLABSI risk. Routine replacement increases infection risk. Question 55. A nurse is caring for a child with suspected intussusception. Which assessment finding is most concerning? A. Intermittent abdominal pain. B. Vomiting. C. Current jelly stools. D. Decreased appetite. Answer: C. Current jelly stools. Rationale: this finding indicates bowel ischemia and requires urgent intervention. Question 56. Yes or no? Should a nurse delay reporting suspected abuse if the caregiver appears cooperative and concerned? A. Yes. B. No. Answer: B. No. Rationale: mandated reporting is required regardless of caregiver behavior. Question 57. A nurse is delegating tasks on a pediatric unit. Which assignment is most appropriate for UAP? A. Assessing pain in a nonverbal infant. B. Reinforcing insulin teaching. C. Obtaining routine vital signs on a stable child. D. Administering oral medications. Answer: C. Obtaining routine vital signs on a stable child. Rationale: UAP may perform routine, non-assessment tasks on stable patients. Question 58. True or false? Pediatric patients experiencing pain may display behavioral changes rather than verbal complaints. A. True. B. False. Answer: A. True. Rationale: developmental limitations often lead children to express pain behaviorally. Question 59. A nurse evaluates handoff communication for a pediatric trauma patient. Which information is most critical to include? A. Family visitation preferences. B. Time of last meal. C. Airway status and interventions performed. D. Room assignment. Answer: C. Airway status and interventions performed. Rationale: airway information is essential for continuity and patient safety in trauma care. Question 60. Which indicators suggest effective clinical judgment by a pediatric nurse? A. Anticipating complications before they occur. B. Relying solely on provider instructions. C. Integrating assessment trends over time. D. Escalating care based on subtle changes. Answer: A. Anticipating complications before they occur. And C. Integrating assessment trends over time. And D. Escalating care based on subtle changes. Rationale: clinical judgment emphasizes anticipation, pattern recognition, and proactive escalation. Question 61. A nurse is caring for a 3-year-old admitted with suspected epiglottitis. Which nursing action is unsafe? A. Keeping the child calm and upright. B. Allowing the parent to remain at the bedside. C. Preparing emergency airway equipment. D. Inspecting the throat with a tongue depressor. Answer: D. Inspecting the throat with a tongue depressor. Rationale: throat inspection can trigger laryngospasm and complete airway obstruction. All other actions support airway preservation. Question 62. A nurse is caring for a child receiving IV opioids postoperatively. Which nursing action is unsafe? A. Monitoring respiratory rate every hour. B. Administering the medication as prescribed. C. Allowing the child to sleep without reassessment. D. Having naloxone available. Answer: C. Allowing the child to sleep without reassessment. Rationale: opioids can cause respiratory depression during sleep. Continuous reassessment is critical. Question 63. A nurse is managing care for a child with diabetic ketoacidosis, DKA. Which nursing action is unsafe? A. Monitoring neurological status frequently. B. Administering insulin via continuous infusion. C. Rapidly correcting hyperglycemia with IV insulin bolus. D. Monitoring serum electrolytes closely. Answer: C. Rapidly correcting hyperglycemia with IV insulin bolus. Rationale: rapid glucose correction increases the risk of cerebral edema, a life-threatening complication in children. Question 64. A nurse is preparing to discharge a child with a ventriculoperitoneal VP shunt. Which instruction is unsafe? A. Report vomiting or lethargy immediately. B. Teach parents to monitor head circumference. C. Encourage contact sports to promote normal activity. D. Instruct caregivers to observe for signs of infection. Answer: C. Encourage contact sports to promote normal activity. Rationale: contact sports increase the risk of shunt damage and intracranial injury. Question 65. A nurse is caring for a neutropenic child receiving chemotherapy. Which nursing action is unsafe? A. Performing strict hand hygiene. B. Allowing fresh flowers in the room. C. Screening visitors for illness. D. Using aseptic technique for line care. Answer: B. Allowing fresh flowers in the room. Rationale: flowers and plants harbor bacteria and fungi, posing a serious infection risk to immunocompromised children. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.